All right, let's go ahead and pick it back up. Long time no see. Thanks for coming back, everybody. All right, so we left off yesterday lamenting the fact that painless surgery was not a thing. And even if you got through surgery being held down by 4 to 5 very stout people, you would very likely succumb to an infection after the fact. So what started to change this? Well, people had noticed that there were ways to make pain a little less intense. One of the more famous ones was a French military surgeon named Dominique Leray, was actually working on soldiers and amputating their limbs during the French, the French-Prussian War? Thank you. I've got my glasses on today and I'm still having trouble reading it. French-Russian War. So at the Battle of Borodino, he noted that the people who'd been on the battlefield and kind of in icy, snowy conditions for longer actually had less pain when he would conduct the amputation. So he actually started bringing snow and ice into the tents and trying to freeze people's legs down a little bit beforehand. But that was really about as good as it got. And quick note, he also was a fairly good innovator trying to bring rapid evacuation from the battlefield into practice with horse-drawn carriages at the time. But aside from alcohol, ice, morphine, that wasn't even morphine, it was just basically opium at the time, there was really nothing people could do to make surgery any less horrific than it was. This all changed, and have a moment of patriotic pride. The first major American contribution to surgery and medicine in general was the discovery of surgical anesthesia. So take a moment, stare off into the distance, think of the Stars and Stripes, and then have it come crashing down, because this is the most dysfunctional, horrific, ego-driven story in the entire history of medicine. If you've been with me for the last few talks, that really says a lot. So, back in the day, we didn't have movie theaters, we didn't have TV, so people would have to go to the theater for entertainment, but they would do other things as well. And one of the things they would do would go to laughing gas parties, which is exactly what it sounds like. You would inhale nitrous oxide, you'd get silly and wander around and do dumb things, and people would laugh at you, and it'd be fun. And at a laughing gas party, a dentist named Horace Wells was going back to his seat. There's a few different stories about how exactly this transpired, but basically on the way back to his seat, he rammed his knee into a table or a chair, but had no idea it had happened until the next morning. Being a dentist, he thought, I didn't feel any pain. I wonder if I could use this to actually pull teeth and make it less painful. And anybody here ever have nitrous oxide when they're at the dentist? Yeah. So it actually works. He would experiment doing nitrous oxide tooth extractions, and it was fairly potent. He was able to help pull teeth that way. He had some students who also learned the technique, and he thought a little bit higher about it. He thought maybe we could use this for something beyond tooth pulling. Maybe we could actually make it work in surgery. So he talked to a very respected, very well-known Boston surgeon named John Collins Warren, who was nearing the end of his career in Boston General. And take a moment for Dr. Warren here. He'd been doing surgery his entire career. He was used to screaming and ranting and people trying to flee the operating theater with their guts hanging out or operations partially done. And he'd been through all of this. And so this guy comes along and says, I think I can make surgery painless. He said, well, we'll give it a try. This patient of the day backed out. And so instead, Horace Wells offered to pull the tooth of any of the students who were there. So they were gathered around an amphitheater, and one of the students volunteered. He had a bad tooth. And so Horace Wells pulled the tooth, and afterwards the student said he didn't feel any pain. But at the moment the tooth was pulled, he let out a yelp. And that was enough for the crowd. Now, med students get a little bit of a rough reputation for being a little bit boisterous, a little bit disrespectful. You guys got nothing on the people from the 1800s. At this point, it basically erupted into a riot. The students just screaming abuse at this guy who came in and made Dr. Warren look like a jerk. And the most damning thing they yelled at him as they kind of shuffled him out of the theater was, humbug. Apparently that was just a step too far back in the day. So, Horace Wells left in disgrace, but one of his students decided that not only was nitrous oxide worthwhile, but there were other things that could make people insensible that were worth trying. And William Morton, the student, had been to a few ether frolics. Now, we've covered laughing gas parties. What do you think an ether frolic is? Yeah, you take a rag of ether, suck it in, and then you have a good time with your friends and family. So yeah, basically basically inhaling the ether was considered to be a good time back in the day before TV. But he thought, well, ether makes you relatively insensible and unaware of what's going on around you. And he would experiment with that in tooth pulling. And almost a year to the date, he set up another session with John Collins Warren, who, once again, let's give him some props. After this fiasco, only a year earlier, he's willing to give one more person a chance to anesthetize a patient prior to a procedure. So William Morton brought in this handmade, glass-blown ether inhaler. And this time, the patient didn't back out. The patient had a salivary gland tumor that was just massive, and it had grown around the guy's jaw. Now, take a moment and think about how you're going to conduct surgery to remove a salivary gland tumor on someone who's writhing around in pain on the table. So he administered the ether, the guy got knocked out. They did the procedure within about 20 minutes, and when the patient came to, he actually asked, when are you going to start? So the significance of this was not lost on anyone. It was immediately considered to be a massive step forward. And John Collins Warren, let's give it up one more time, spoke the immortal words, "Gentlemen, this is no humbug." So if anybody out there has the guts to bring humbug back, I'd greatly appreciate it. So there we go. So everything should have been fantastic. Everything should have been awesome, but it wasn't. It wasn't awesome because William Morton, the student of Horace Wells, had a history of being a con man. He would go from town to town, ripping people off, starting companies, buying stuff on credit, and then leaving without actually selling anything. He got engaged to multiple women who were the daughters of rich merchants in the area and basically trying to get married before the father had figured out that he was a no-good kind of con man, never quite pulled it off. So he knew a good deal when he saw one. So he wanted to patent this method of surgical anesthesia. The problem is ether had been around for hundreds of years at this point. People had known about ether but not figured out that it had this application. So he can't patent it, but he needs to try. So he starts disguising it and trying to add other scents to it, and he calls it Letheon, something that is going to bring sleep. Another problem comes up. He had been talking with a chemist at Harvard about this process and getting the ether form. This guy was Charles Jackson. Charles Jackson had helped him with it, and when he heard about what happened, he said, hey, I need half the credit and I need half the proceeds from this. I don't mind that you're going to try to patent something that's unpatentable. I care that I need credit. Jackson had a weird history of thinking he'd been ripped off. He thought he'd invented the telegraph, and Samuel Morse code, had not. He thought he had invented gunpowder and Alfred Nobel had not, and that they'd ripped him off, and the list goes on. So he had a history of feeling that he'd been denied credit for stuff that he'd done, and he was not going to let this slip through his fingers. So the two of them tried to get along, they really couldn't, and they just started a war of words between each other, libeling each other, creating various advertisements, damning the other, saying that they were a fraud, that they weren't really worth involvement in the process, and it became a national embarrassment. And they also started bad-mouthing Horace Wells, the guy who started with the anesthesia using nitrous oxide. Wells had left his family and continued experimenting with chloroform and other anesthetics on his own, basically inhaling them and tracking how his progression of insensibility proceeded, and it started to affect his mind. He went to Paris to try to press his case as the inventor of the entire concept of surgical anesthesia, was turned down, and ended his life on an ether and chloroform binge, throwing sulfuric acid at two women in the streets of New York, and he got imprisoned for it. Came to, got his senses back, realized what he'd done, and asked the people at the jail if he could go get his shaving kit from home. They let him, and in his jail cell he administered some chloroform and used a razor to slit his femoral veins. And so he killed himself as a process of this. Not the last life that will be ruined in the process of discovering the way to make surgery painless. So, the major American advance in surgery has been found, and yet the people squabbling over credit for it are making it into an absolute fiasco. So the government puts up $100,000 as a prize for anyone who can prove they used and have applied surgical anesthesia first. This is $1,850 or $1,860, $100,000. So Charles Jackson and William Morton are kind of vying their case in the press, and Morton gets in a carriage and goes to Washington, D.C. in the middle of the summer, but suffers a stroke and jumps into a lake on the way there, dies shortly thereafter after his family fishes him out and realizes that he's had a big stroke and he's really incapable of proceeding. Several years later, according to, I've only seen this in one history, but I really love this story, so I hope it's true. But Sherwin Newland, a historian of surgery and of medicine, said that Charles Jackson was attending a funeral in Cambridge, Massachusetts, and walked by William Morton's grave. And what was on William Morton's grave was this: William T.G. Morton, inventor and revealer of anesthetic inhalation, by whom pain in surgery was averted and annulled, before whom in all time surgery was agony. So he reads this on the grave of the man he's hated intensely, passionately for years, and he acutely went psychotic and never recovered. Died in an asylum shortly thereafter, and naturally was buried in the same Cambridge cemetery as his great rival. So no one ever gets the prize. It's a squalid, horrible story of ego gone mad. And to top it off, 4 years prior to the demonstration at Boston General, it turns out a rural surgeon in Georgia named Crawford Long had actually used ether several times to remove warts, small tumors, do minor procedures, and really wasn't interested in pressing his case until his friends and family said, there's $100,000. You should really consider telling people you did this. So of all the people involved, only Crawford Long actually had any dignified response to it. He pressed his case a little bit, didn't make a big deal out of it, and eventually passed away in the middle of delivering a baby on his normal rounds, felt the darkness creeping in, handed the baby off to the nurse, fell over, dead. So, that's the story of surgical anesthesia. Now, despite their attempt to patent it and obscure the fact that it was simply ether, people in the know immediately understood the significance, and the word was out across the world that ether could be used to create surgical anesthesia and do painless surgery. So in England, this was taken up really readily, especially by one of the luminaries of surgery at the time, Dr. Simpson. Before Simpson, we have Robert Liston. So Robert Liston was a renowned, high-status surgeon, but he was also very experimentally minded. He tried to use mesmerism to actually induce surgical anesthesia, and it worked. He was actually able to use mesmerists from France to induce a trance-like state and do painless surgery. But it took hours. It took hours of mesmerism for those people to reach the point where they could be operated on. Whereas ether, instant. You could pretty much put somebody out within minutes and be operating on them. Now, he was a classic surgeon of the old school where speed was essential. Now, think about it. We didn't have anesthesia, so does it make sense that surgery should be fast? What do you think? Surgeons would actually time themselves to see how quickly they could do different procedures. I think his record was a 2.5-minute lower limb amputation at the thigh. And that kind of speed came with some consequences. Some of his assistants lost fingers. One of his patients lost his testicles during a thigh amputation that went a little too quickly and a little too roughly. And he's renowned for having the only procedure in the history of surgery to have a 300% mortality rate. So he was removing a leg from his patient. In the midst of removing the leg, you'd basically clamp down on the femoral artery, get your falciform knife, big curved knife out, you'd get your arm around the person's thigh, and as quick as you could, rip through as much tissue with that curved knife as possible. Yeah, his assistant had 2 fingers in the way, so the patient, in the midst of having his leg amputated, his assistant got his fingers amputated. The assistant jumped back. Liston was surprised. He jumped back, and the knife went flying into the crowd. Didn't actually hit anybody, but it caused the man in the front row to have a heart attack and die. The patient and the assistant later died of septic infection for their wounds, hence the 300% mortality rate from this single procedure. Now, that doesn't make Liston look particularly good, but he was an excellent surgeon, but speed was paramount, and people got carried away. So, and by the way, Robert Knox was the surgical anatomist up in Edinburgh at the time who'd received a lot of the bodies from Burke and Hare. Liston actually went up to Edinburgh and got in a fist fight with him in front of his class during a lecture because one of the people he knew in Edinburgh had been killed by Burke and Hare and used in the anatomy teaching that Knox was doing at the time. So, interesting guy. And I also love another old-timey quote about the discovery of surgical anesthesia from America. "This Yankee dodge beats mesmerism hollow." Now, if you take a moment to decipher that, basically, hey, this American innovation is way better than that French hypnotist thing. Yeah, and he's right. So the next step forward was again in the UK. James Simpson in Edinburgh had worked with surgical anesthesia and ether, but thought that there might be other substances that would be even better. So he would actually have friends over, and they would sample various odorific chemicals and see if it induced the same sort of state. And one day they decided to try chloroform. As the story goes, they were gathered on the table, they opened up the chloroform bottle, and when they woke up under the table and opened the windows, they thought, okay, this might actually be pretty potent. We might actually have to try this. And so chloroform anesthesia came around. Now, chloroform was actually way less irritating and also much faster than ether, so it became very prominent right away. Before anybody thinks that this is going to be a great shortcut for surgical anesthesia, though, chloroform is this weird thing where it will just spontaneously kill some people. Like some people will just die very quickly from inhalation of chloroform, and there's really no way to tell who's going to succumb to that. So it has some very variable effects from person to person. But it was used in a lot of surgical procedures, and it began to be used during childbirth. This was actually very controversial, and in fact, one of the higher-ups in the Church of England actually said that he objected to it because it did rob God of the deep and earnest cries of a mother in labor. So, yeah. Fortunately, that objection didn't last very long because John Snow, the same John Snow who figured out the cholera epidemic was being spread through the Broad Street well and pump, was also an obstetrician, and he was very high status. He delivered Queen Victoria's children, and when the Queen took chloroform to ease the pain of childbirth, debate was over. It was approved. No one was going to be smack-talking it after that. So one thing I want to drive home is power, privilege, and prestige are not always bad things. They often are, but Snow couldn't have done any of the work he did with the cholera epidemic or anesthesia if it weren't for the fact that he was high status in the medical world in England at the time. That status gave him the ability to innovate without overly being criticized by his contemporaries. And by all means, when the Queen does something, then it's taken care of. So it's very interesting that medical advances are sometimes helped, sometimes hindered by the power structures in place at the time. So, surgery is now potentially painless, but we've done nothing to deal with the fact that it's also potentially lethal because you can have a massive infection once you're done and there's not much you can do about it. No concept of the germ theory of disease or even infection had taken hold. That is until we get to Joseph Lister. And if you're thinking that sounds familiar, he did not invent Listerine, but it was named in his honor, because it involves phenol, which is what he used to make his big discovery. Well, before I say that, let me back up. His major tool for discovery was the use of the microscope. His father was a very good Quaker, and Quakers at the time tended to have what we would call scientific or natural philosophic hobbies. And his father was a microscopist. He'd actually figured out how to stop microscopes from splitting different wavelengths of light differently and causing chromatic aberration. So he grew up using microscopes, something very few people knew how to use. And when he was training in surgery, he kind of tinkered on with the microscope, but eventually he talked to a colleague who'd finally cut up on some reading from France and said, there's this guy named Pasteur who did this really amazing thing. He figured out that there were small little animals, microscopic animals or animalcules that were causing the beer and the wine and the silk to rot or to go bad. Lister, right person, right place, right attitude, thought, I wonder if that has anything to do with having wounds go bad. And so he took samples of the pus that would develop on patients after surgery and discovered that the different types of pus were associated with different types of bacteria. Bacteria weren't really a thing then, but that was what it turned out to be. The so-called laudable pus that people had been actually hoping to see after various surgeries is now what we know as staphylococcus. Now, it's not good to have a staph infection, but it's better than some of the other options because staph doesn't tend to spread widely. It tends to create thick, whitish pus that stays near the site of infection. Other infections would have very reddish, inflamed irritation around the area that would spread centrally through the vessels. That was streptococcus. He saw a different set of microorganisms when he would investigate those wounds under the slide. And worst of all, watery, smelly, necrotic infections were caused by Clostridium. That was going to be gas gangrene. So he immediately grasped the significance of this. These things were what caused infection to happen after surgery, and doing further reading, he discovered that people had used phenol, called carbolic acid at the time, to deal with it and to kill them off. So he invented phenol sprayers, and he would spray phenol over the instruments, over the hands of the surgeons, over the field. Now, he went overboard by contemporary standards, but at the time, it was a very good idea. He didn't know how the bacteria were getting there, so he sprayed everything with phenol. And his procedures had a massive bump up in success. People did not die when he would operate on them. An open fracture, a complex fracture with the bone sticking out, used to be a death sentence. People undergoing these procedures now with him would survive. And he would spray that phenol on everything, even spray it into the air, just kind of mist it around. Now, who's been around phenol before? It's not especially pleasant, but the outcome was such that he kept on pushing it. But this was a big switch. Instead of going fast and quick, he was asking surgeons to slow down, spray their hands, spray their tools, take their time. This was absolutely contrary to the whole concept of what being a surgeon was. And in fact, what a surgeon was at the time was almost guaranteed to cause infection. The surgeons were supposed to operate quickly, so they would kind of have their knife, and if the knife got a little bit dull, they'd kind of strop it on the bottom of their shoe or kind of wipe it on their coat. A mark of status as a surgeon was how filthy and caked with blood and pus your overcoat, your frock coat was. So essentially you had this massively infectious piece of material you were wearing to all your procedures, treating your scalpel falls on the ground, go back into it, keep going from there. So it really contradicted what surgeons wanted to do, and there was a lot of resistance to any sort of change that made it more meticulous and slow. And in fact, there were other scientific objections as well. Turns out they have no basis in reality, but at the time, there was at least some thought that infection was not caused by these weird little nanomolecules that people had seen under the microscope. One of the prevailing theories was oxygen was well known, and it was thought that when oxygen entered a wound, it caused the inflammation and the infection. And so it was important to operate quickly to let less oxygen into the wound. That was the idea of Dr. Gross in Philadelphia, a very famous American surgeon. And if you've ever seen this painting, that is Dr. Gross. It's called the Gross Clinic, not because of gross anatomy or anything disgusting, but that was actually just his name. So people resisted for a while. But Joseph Lister had something almost no one else in this series of talks had had. He was humble, he was persistent, and he did not take offense lightly, and he didn't let people stop him just because he kept getting poo-pooed by them. He persisted, and eventually Listerian surgery and antiseptic methods gained traction and became the norm. And basically they did it in the three typical ways. Demonstrably superior outcomes. You could actually point to the numbers and say, it does work. If you change your method, you will have better outcomes. He had a great deal of persistence, and he would go on lecture circuits throughout the world trying to convince people that this worked. And as usual, genius is never appreciated at home. The last people to really buy in were people in the UK. But in continental Europe and America, it started to gain a lot more traction. And sadly, one of the major ways that innovation proceeds is that its critics in the older generation die. And the newer people who are left are far less resistant to that innovation and proceed with it. Now, eventually, the the idea of antisepsis gave way to asepsis. Let's just sterilize things in the first place, autoclave it, steam it, and not worry about the infection being stopped. Let's just not let microbes into the operating theater, period. But that only came after. Oh, it was actually said Lister was present at an honorific banquet for Louis Pasteur when he was an old man, and Louis Pasteur broke down in tears and said that if the only thing he had ever done was allowed Lister to make his work public, then his life was a success, basically saying that Lister's growth off of Pasteur's work was enough for an entire career. So they were both very appreciative of each other and very aware that their work really built on and relied on each other. So we brought up America in the context of surgical anesthesia. It took a little while for American medicine to get to the point where Listerian surgical antisepsis took place, because Philadelphia had a very good start as an American medical high culture point. But in the 1860s, when the Civil War hit, it just decimated American infrastructure. The Civil War did not just result in lots of deaths, it resulted in many deaths of the youngest generation of people who would become doctors. It completely obliterated the American infrastructure. There was no money to spend on making things better. And American culture and medicine, as a reflection of that, really took a dive and stayed low for 20 to 30 years. The next big bump in the prestige of American surgery and American medicine in general comes to the life of William Halsted. Now, William Halsted came from a very wealthy New York family. His family were not really doctors. It was kind of a surprise that he wanted to go into medicine at all, instead of business or law or politics. But he went to Yale and eventually got a medical degree. And at that point in America, medical education was incredibly variable. No uniformity, no quality control. These days, I yearn for far less quality control from our agencies that oversee us. However, I think the happy medium is somewhere in between. But at this point, there was no quality control. So if you were wealthy and you wanted to be a good doctor, a good surgeon, you would go to Europe and you would just visit various hospitals, travel around Europe, visit laboratories, hospitals, see how people were doing things all over Germany and France and England, and then come back and practice in America as somebody who'd been trained well on the continent where the real experimental, worthwhile work was being done. American medical schools were really low-key and really variable and actually pretty terrible most often in their ability to train people well. So he came back, brought Listerian methods with him, and actually paid for a Listerian suite at the hospital where he worked. They actually wouldn't give him rooms, so he and his friends pooled their money and built a tent that they would do antiseptic, phenol-based surgeries in the hospital, kind of, not the front yard, but kind of an ante-room little area surrounded by the hospital buildings. So he worked like a dog. He wrote nonstop. He researched nonstop. He had a group of friends that worked very diligently, doing a lot of research, a lot of surgery, and then they'd go out and party. They were burning the candle at every possible end, and he was rocketing to the top of the New York medical scene, a rising star, and then something terrible happened. He and his colleagues started investigating a new anesthetic that could be used to numb peripheral nerves. This was cocaine. So cocaine was just available to buy. You could just get it. And people in Europe, like Sigmund Freud and Karl Kohler, had used it in various ways. Kohler figured out that you could numb the eye and do eye surgeries with it, but Halsted thought that maybe it could be used to numb peripheral nerves. Instead of knocking someone out with ether or chloroform, maybe we could just numb a particular area and do a procedure. So he and his friends would inject themselves with cocaine, see how the numbness worked, and they had a neat little side effect. They were really energized after this, and they'd go out and party for a while, then go back and write and research it, quote unquote research it, and eventually it did what you'd expect. It wrecked their constitution. They were incapable of working. They were agitated. They were just completely, just really frantic, going from high to low all the time. And several of the colleagues he worked with died as a result of their addiction. He crashed, but not before finally writing his paper on the effects of cocaine as a topical, or not topical, pardon me, as a peripheral anesthetic. So here's a sample of what he wrote. Actually, before I do that, here's a quick ad for cocaine. Hey, is your kid teething? Here, give him some coke. If that's not good enough, we'll give him some morphine, knock him out. It was just available. So here's what he wrote, and I actually, instead of reading this, I'll just let you guys read this. This is one sentence. This is what it did to his mind. I'll give everybody about 30 seconds. Just try to comprehend what the hell he was talking about there. So through no fault of his own, not knowing that this was an addictive drug, he had wrecked his life, wrecked his practice, and was pretty much, waiting to die alongside many of his colleagues. Thankfully, he had a colleague, William Welch, who had just taken up the chair of pathology at Johns Hopkins. Johns Hopkins had just come into existence, and he said, okay, Halstead, why don't you come down and be my laboratory tech? We'll help you get yourself back on your feet. I'll watch over you, make sure you're not falling back, having any relapses. And so he came to Hopkins as a laboratory technician, and he gradually got better. But the mercurial, very frantic, dashing about surgeon had been replaced by a slow, meticulous, very deliberate operator. And his surgeries continued to be very effective, but they were now slow and nearly bloodless. He would ligate every artery. He would ligate everything that bled. It said you could be horrified at the sight of blood and still watch one of his surgeries because every little vessel was cauterized or ligated right away. And his procedures were fantastic. He started investigating different ways to treat different procedures using anesthetics, using antiseptics, and he pioneered a lot of different surgical approaches that had never been tried or even contemplated before. And when the chair of surgery that they'd hired from Scotland backed out, Halstead was made chair of surgery at the new Johns Hopkins Medical School, along with the four luminaries at the time, William Welch, Halstead, William Osler, and the fourth one whose name I'm going to forget. He was the OB-GYN. Okay, forgive me. Anyhow, he started looking at ways to repair hernias. No one really understood what a hernia was. It was a bulge through your body wall or into your scrotum, but no one really knew what was going on. He researched the layers, came up with ways to treat it. He figured out how to do thyroid surgery. Anyone who tried thyroid surgery before inevitably nicked the organ and released what was called a thyroid storm, as those hormones flooded the bloodstream and caused a massive problem as a result. He did one of the first gallbladder operations, which is relatively similar to the way we do it now, on his own mother on a kitchen table, because he could tell that she was having a gallbladder attack that would likely kill her. So he, assisted by his sister and father, held the mom down, tried to get her some anesthetic, and did a gallbladder removal operation on her that became the standard for many years thereafter. Now, one of the more impressive things he did, which has given him actually quite a bit of negative criticism in the last few decades, was he pioneered the radical mastectomy. Now, the Halstead radical mastectomy is exactly what it sounds like. It's a radical removal of the breast, taking the breast, all the underlying tissues, the pectoralis major, pectoralis minor, and as much of the lymphatic tissue as possible up into the axilla. Now, this is a brutal procedure, which is why he's come in for a lot of criticism. But at the time, breast cancer was a death sentence. You were going to die, and it was probably going to be very painful, and you would have rotting ulcers on your chest that would isolate you from friends and family, and it would not be pleasant in any way. This illustration shows the state-of-the-art of breast cancer treatment prior to Halstead. Essentially, the breast was pulled up, spikes were shoved through it, ropes were tied to the spikes, it was pulled upward, and a knife cut the breast off. And then we applied cautery to the stump. Now think for a moment about lymphatic spread of the cancer. Think about how tumor cells actually move. Is this going to fix the problem? No. It's going to be horrifically painful, and you're still going to die of the same thing that would have killed you anyway. With Halstead, outcomes actually improved. Yeah, it's a brutal surgery. We don't do it as much anymore because we have way better options now. We have much better early screening to detect these tumors and deal with them far in advance of them getting this bad. But it was a massive step forward. This is actually one of his own drawings showing what the tissues were, and people would survive their diagnosis with this procedure very regularly. Now, if that weren't good enough, he invented rubber gloves. So every time you guys are in the lab and you pull some latex gloves on, instead of touching the cadaver with your bare hands, utter a small word of thanks to William Halsted. He invented rubber gloves because his surgical nurse reacted badly to the the phenol that they would spray, and her hands would get red and beefy. So he thought, I should see if we can do something about that. And being a rich upper-class socialite, he thought, I'll call my friends in the upper administration of the Goodyear Company and see if they can make some gloves out of rubber. And they did. And he eventually married Carolyn Hampton, that nurse who he had made the gloves for, and now we have surgical gloves and gloves for our anatomy lab. He also pioneered, he didn't create it, William Osler is credited with that, but he really pioneered the modern surgical residency where each stage trains the stage below, and you have a chief resident who trains those below, who train those below, and so forth. Now, he needed this procedure where the senior students took on a lot of leadership, and the reason he needed it is despite his decades of productive work, he never quite kicked the habit. He got off cocaine by getting on to morphine. And he would disappear for months at a time and just go on a bender, largely in Europe, sometimes at a country estate that his wife owned. So the fact that he was this productive while still actively addicted to these substances is just phenomenal. Now, one quick word though, he's very praiseworthy, but he was an abrasive, unpleasant person to be around. He was renowned for just not so much screaming verbal abuse at the people around him, but just making very sarcastic, cutting insults about their competency and just letting them kind of stew on that as they went. Which is unfortunate because he had some of the most renowned surgeons in the world training under him. Harvey Cushing hated Halsted. He trained under him, but he never really cared for the man. And in fact, he was much closer with William Osler, the head of internal medicine at Hopkins. And actually, Cushing drew this picture on the right, and that's actually William Osler kind of depicted with the trepidation there. I think it was more of a send-off of enjoyment rather than any sort of wish fulfillment. But Cushing is basically the father of modern neurosurgery. Prior to Cushing, the possible survival of a neurologic procedure was around 10% if you were lucky. By the time he retired, you had a 92% chance of living through a neurologic procedure, at least, and having a few good years. He did a lot of research, actually used cocaine as a topical anesthetic to do some of these procedures, and kind of hating his mentor Halsted, he was actually kind of thrilled to figure out why Halsted never made that jump. He's like, he was afraid to use cocaine because he was addicted to it for so long. Showed him. But he would use it to treat these various things, came up with different neurologic procedures, and did well over, I believe it was 2,000 procedures in his lifetime before retiring. He had a rival who was also another student at Hopkins, and this was Walter Dandy, the other father of neuroscientists. So neuroscience does indeed have two daddies, Dandy and Cushing. Dandy came from a lower class background and I don't think Cushing had much of a rivalry with Dandy, but Dandy definitely had a rivalry with Cushing and was always trying to surpass him, always trying to do a little bit better than this upper class guy from Ohio. So Dandy is the person who figured out how CSF circulation works. If you've heard of Walker-Dandy malformation, that is named for him. He did something I still find phenomenal, which is X-rays had come into existence at this point. William Roentgen had figured out how X-rays work, and they would use them. But if you took an X-ray of a skull, it didn't really tell you much about the brain. You needed air for contrast. So Dandy would actually drain the CSF out of his patient's ventricles and subarachnoid space, take an X-ray, and maybe be able to spot where a tumor was as a result. So he was able to figure out some ways to apply the imaging at the time to neurosurgery. And one thing I want you to kind of think about with he and Cushing, they didn't have imaging before they operated, meaning they had to open up someone's skull relying strictly on a very thorough neurologic exam. They had to open up that skull and say, we are certain the tumor or the infarct is right here, and we're going to open up a little window in the skull, And if they were wrong, they opened up the window and nothing was there, and it was all pretty much for nothing. So that was strictly due to that neurologic exam and really fundamentally understanding how it manifested in the signs and symptoms of their patients. Oh, also I should mention, Dandy is the first person to figure out that sciatica and nerve impingement could be caused by herniated nucleus pulposus. So, big one for us. So, Hopkins continues from success to success. That experimental mindset, that embrace of high quality control in both the professors and the research that was being done, culminated in the first true heart operation. Now, not thoracic operation, we'll talk about that next Wednesday, but the first true heart operation was done at Hopkins, and it was done on a child with tetralogy of Fallot. Now, Hopkins had taken in women students, and as we mentioned previously, it wasn't exactly equal, but it was way more equal than any other medical school at the time. And Helen Taussig was a Hopkins grad. She'd kind of been steered away from a medical career her entire life. People said, oh, go into public health. That's a better career for a woman. This medical thing's probably not the best. But she didn't take no for an answer. And after completing her degree, she was given a job at the pediatric cardiology unit at Hopkins. Now, at the time, that just meant making the children feel better, helping them to pass away more easily, because there was no way to deal with any heart malformation, let alone the heart malformations that occur in children. She wasn't really satisfied with that. She had access to a fluoroscope. She visited another woman named Maud Abbott in Canada at McGill, who had a very extensive collection of malformations of the heart, and you can imagine they got a lot of snide commentary, oh, you women and your hearts, ha ha ha. But they were the two experts on pediatric heart malformations at the time. And Helen Taussig started to figure out which malformations her patients had based on their type of cyanosis, what sort of things made it worse, made it better, what kind of murmurs and thrills they had, and was able to figure out basically where the problems were. Now, this is a picture taken near the end of her life, and one quick aside, manual dexterity and skill in palpation is not a strictly osteopathic thing, even though we do a lot of work to make sure that you're very skilled with your hands. But this picture was taken for Time magazine, and it's a lie. It's a lie because she never used a stethoscope. Helen Taussig was mostly deaf from an infection as a child, and she palpated her children's patients' chests to figure out where the murmurs were. She was able to palpate those murmurs and those thrills and other things, and those bruits and things of that nature. So the bar's been set, people. Go ahead, try to diagnose those murmurs based on tactile feedback alone. So she listened with her fingers, and eventually she wrote a textbook on pediatric malformations of the heart. But one thing she noticed was that her patients with tetralogy of Fallot did better if they had a patent ductus arteriosus. Now, if you remember your heart anatomy, it makes sense. If you've got cyanosis, it's good to have some crosstalk between your aorta and your pulmonary artery. And she also noted that when her patients would have their ductus closed, they went really badly south and would die shortly thereafter. So her thought was, well, why don't we build a ductus? Why don't we build something that will actually make that a normal part of the anatomy? Now, she was a pediatric cardiologist prior to surgery. She didn't know how to do that. But she went to the chief of surgery at Hopkins, a guy named Alfred Blalock, shown on the left. And Alfred Blalock was from Kentucky, Louisville. And he was a little bit resistant at first, but his major work prior to coming to Hopkins was on surgical shock. And that work had been done to see how you could deal with pulmonary hypertension. And to deal with it, he and his lab assistant had sutured the arteries of the large arteries of the aorta, subclavian artery, etc., to the pulmonary trunk. So he'd actually done work that was very similar. Now, in addition to being an excellent surgeon, he had something no one else had. He had the best laboratory technician in the world. The guy on the right here, Vivien Thomas. Now, Vivien Thomas wanted to go to medical school, but being poor and being black, he had very few options, and eventually got a job as a custodian at Vanderbilt in Blalock's lab. Blalock, to his credit, realized that this guy was incredibly sharp and incredibly good with his hands. And so pretty soon, Vivien Thomas was running every aspect of Blalock's research program and went with him to Hopkins when he got the job there. So, discussions were held about how he could deal with that. They did lots of experiments on dogs to try to figure out how they could actually route the blood around the heart to actually create an artificial ductus arteriosus to help children with tetralogy of Fallot. And they'd done some work, they were getting close to it, and Vivien Thomas had put a lot of work in trying to suture the vessels in just the right way, when it became very clear that one of the patients, Eileen Saxon, whose parents had agreed to the procedure, her ductus was closing and she was about to die. Now, she was tiny. So imagine the first heart operation not being done on an adult, but being done on somebody this long. And so they prepped her for surgery and it was scheduled. Here's the problem. Blalock, the surgeon, the chief of surgery at Johns Hopkins, had not done the procedure before. It had only been done by Vivien Thomas. I think maybe Blalock had assisted or done one on his own, but Thomas was the real expert. And so in the 1940s, in Baltimore, a very racially divided city, Blalock started the procedure and stopped it and said, I need Vivien in here. And so the chief of surgery at Johns Hopkins did the procedure with his laboratory assistant, Vivien Thomas, leaning over his shoulder on a stool, saying, no, don't cut there. Okay, do that suture. Not that vessel. And because it was so tiny, they're going by tactile feel alone, the story in the room was they weren't sure if they'd succeeded until they set the final stitch and removed a clamp, and this little baby girl, who had been blue as the shirts of many of you in this room, turned pink all at once, and they knew they'd done it. So this was a major advance. It was the first really the first operation around the heart that had ever been successful, and it rocketed everybody involved to fame. And there was an HBO movie about it starring Snape himself, Alan Rickman as Blalock, and he's awesome, as is Mos Def playing Vivien Thomas. And by the way, yes, I ugly cried for the last 10 minutes of this entire movie, so highly recommended. It's really good. So the Blalock-Taussig shunt was an immediate success, and everybody involved was in Time and Life magazine. They had lots of interviews, except for, of course, Vivien Thomas, the black laboratory technician who'd done a lot of the work. Now, Vivien Thomas was not publicly bitter about this, but his recognition for his role in this was a long time coming, but eventually it was recognized. He got an honorary medical degree from Hopkins. His portrait is now hung in the hall next to Blalock's, and he basically trained 2 generations worth of heart surgeons. The procedures that he helped pioneer were taught to people at Hopkins, and most of the heart surgeons in the world can pull their lineage back to the people who were in that room on that day. Now, that was fine, but eventually we figured out how to bypass the heart. In 1953, the heart-lung bypass machine was created, allowing arterial flow and pulmonary flow to proceed while the heart was actually detached from the body, and direct repair became an option. And so at that point, the shunt ceased to be a problem because you could go in and actually fix it. And a lot of the people who'd had the procedure done would go back in and have the primary defect corrected and survive thereafter. So where do we go after that? The next thing after heart surgery is actually feasible is looking at how we actually replace defective organs. Transplantation had been tried, and blood transfusion had actually been around for a while, long before anyone understood the rejection phenomenon. And what's interesting is that a lot of times people would be transfused and be fine, and then on a second transfusion, their immune system would react to that antigen that it had seen once before, and the person would die. Kidney transplant had been done between twins. And the person who did that, Dr. Joseph Murray, was actually given the Nobel Prize in Medicine for that, mostly because he had to go uphill against everyone who thought transplantation was morally repugnant as well as just surgically impossible. So kidney transplantation between twins had been done, but transplanting other organs was still the holy grail of surgery at this point. At Stanford, Richard Lohr and Norman Shumway were 2 surgeons who were researching how they could do heart transplantations, and were really shocked one day to discover that one of their former students, a guy named Christian Barnard, back in his home country of South Africa, had actually done a heart transplant. Now, it was a successful heart transplant, but you'll notice that there's something special about that word successful up there. It was successful that the patient lived, and he lived for several weeks, but eventually died. But the fact that it worked at all was a huge bump in the kind of the development of that procedure, and heart transplants started to be done very frequently, and lots of hospitals jumped on the transplant bandwagon. The problem is the rejection phenomenon was known but not understood. No one knew what to do about rejection. And so as these occurred, the surgical techniques were there, but the follow-up techniques were completely non-existent, and eventually transplantation started to dwindle. However, Shumway didn't give up. They actually kept on working for ways to make it effective, and the discovery of cyclosporine and its ability to tamp down the immune reaction to these tissues was found, and they immediately knew this was what they wanted. And they figured out that you could do the heart transplants, give people cyclosporine and other drugs that are derived from it, and actually keep the transplantation viable. And so at this point, transplantation started to become more possible, and it's actually a very commonly done procedure nowadays. And in fact, it's harder to get the organs to transplant than it is to do the procedures anymore. So now the major problem is actually getting organs to transplant. So we're getting close to the modern day. We don't have enough organs to transplant, so what's the next solution? What do you guys think? Make the organs. Yeah, so that's taking us up to where we are right now. Let's make our own organs with stem cells, collagen lattices, and scaffolding that cells can grow onto. So in 2006, Anthony Atlas, I'm going to look up here because I'm still making these names out. So at Wake Forest, Anthony Atala's team made a bladder for someone who'd been born with spina bifida, and their bladder was deinnervated. Now, you may or may not know this yet, but when smooth muscle organs are deinnervated, the smooth muscle tends to react by constricting and staying constricted. So this kid had a bladder that was tonically contracted, and urine really couldn't fill the bladder. It would reflux into the kidneys and was causing kidney death. So they sculpted a new bladder from his bladder epithelium, which is not the problem. His nervous system was the problem, and built it onto a lattice work and implanted it, and it worked. Another one that came along was that we had a lab-grown trachea in 2011, and the trachea was made by basically 3D printing with cellular tissues and collagen, the trachea, and then quote unquote painting on the cells from the patient that would then grow onto this lattice work with a nutrient bath to keep it alive. And there we are. That's pretty much where surgery is at right now. So lots of new venues to pursue, but also lots of tools to go from and move forward with. So, and any questions? Going once, twice, sold. Thank you very much.